Joining us now, Dr. Shimi Kang, a psychiatrist and author based in Vancouver, but currently at a conference in Arizona. For young people, Dr. Kang, who are experiencing the pandemic blues, depression, and anxiety, what sort of hints do you have to help them cope?
Right. Well, we certainly can't wait for the pandemic to end, nor can we make someone else fix the problem. So all of us, parents, teachers, young people, have to get very serious and intentional about those natural antidepressants. Things like routine regular sleep, movement, positive socialization, ideally in person. That means putting down our phones and devices at the dinner table and getting them out of the hallways and lunchrooms in the schools. And also, they love to contribute. So sometimes it's not about themselves, but getting them involved in peer tutoring or helping others. That gives a flood of positive, kind of natural antidepressants. So there are things that we can do and young people can respond to. They love community and they love connecting, and we have to keep encouraging them to do so.
But for some families, there is, of course, a further challenge. Teens who aren't communicating, who are kind of internalizing the issues they're dealing with. So how do parents reach them?
Yeah, so I've worked with teenagers for 20 years as an addiction psychiatrist, and there is a science on engaging young people. Some of the tools are empathy, autonomy, giving them a sense of independence, and optimism. So if we look at each one, empathy is really putting yourself in their shoes, saying something like, you know what, if I were you, I'd be feeling really down too. It must be hard to not be able to see your friends or go to that soccer practice. That's a great way to start the conversation. And then say something that encourages their independence. Like, I can give you some ideas, but in the end, it's up to you. It's your decisions. And always end on optimism, positivity that helps move them out of that stress response and gives them a sense of agency. So something positive in the sense of, you did a really good job last week. I know it was hard. Focusing on the things they're doing well is a very helpful tool for all parents and teachers with young people.
And, the good news is the context, the timing here, right? And pretty well everywhere in the country, the Omicron wave looks like it's receding. Restrictions are easing. But what if there's another sudden downturn? That can happen with variants. How do families stay hopeful? How do they keep their teens hopeful?
Right. Well, it's really important to live in the moment and plan for the future. So you're right. There could be any news coming at any time. However, we want to stay very true to those basic self-care antidepressants every day. Those are good for life in general. Pre-pandemic, we weren't doing well with children and teen mental health. So this is not just a pandemic issue. And also, remaining hope is focusing on what we can do. Getting away from negative language if we can, lockdowns, restrictions. And there is hope. There is light at the end of the tunnel. Things are opening up. But a practice of gratitude, all those little things, being grateful for fresh water, clean air, looking at the positive and putting our focus on that. Where focus goes, neurons grow.
All right, Dr. Kang, thank you.